there. So I just wanted to do a quick walkthrough of my infographic, just to get a chance to kind of explain everything that I've got here. So I'm just going to zoom in here. Here's you got kind of the full view of my infographic. I picked Cisplatin, which is a chemotherapy drug. So as you get started with this infographic, just what should I know? What should this person know as they're going into treatment? So just a little bit of background to start off with, just with cisplatin being a chemotherapy drug used to treat many solid tumors. And then I included a little visual for the range of 10 to 20% of patients with cancer who are treated with cisplatin and similar medications. Then kind of going forward, you see that the average treatment time per session is 6 to 8 hours, just to give the patient a little bit of information about how long they're going to kind of expect to be at the clinic receiving that cisplatin treatment. Some side effects, be on the lookout, nausea, vomiting, kidney problems, trying to keep this language fairly simple, hearing loss, starting with the higher pitches, ringing in the ears, or otherwise known as tinnitus, some nervous system problems such as tingling, burning in the arms or legs, just trying to give them a heads up as they start treatment, what side effects maybe they need to be looking out for. And then from an audiology perspective, while I created this as just a regular doctor who's prescribing this medication, I did want to focus a little bit on the hearing component. So I kind of talked about a little bit how cisplatin can enter the ear a little more easily than some of the other medications. And once it's in the ear, it's kind of hard to get rid of it. And that can kind of lead to some changes in hearing even after the treatment is stopped. And then also talked about a couple of the factors such as higher dosages and age can also impact whether cisplatin is more likely to cause hearing loss. I included this little visual of the anatomy of the ear. So you can see from the outer, the middle, into the inner ear, and I'm directly pointing to the cochlea, which is the inner ear, just trying to give patients a quick visual of kind of where I'm talking about, where that damage may occur. And then I also included a little blurb about how some research has shown that sodium thiosulfate can also help if taken with cisplatin to help reduce some of those hearing loss effects, and just to ask me for more information because that's something that we can talk about while they're in office. And then also it kind of reminded me of some of those videos we've looked at this semester, that patient education component. While being treated, you want to avoid pregnancy and use effective birth control because there can be negative effects on a fetus if pregnancy occurs while taking cisplatin, avoiding sick people, and also letting the doctor know if they're having any of those side effects as I've listed above, making sure, especially those big ones that I've listed, that the patient knows that they should contact me immediately. And then also setting in that that piece of audiology where you want to monitor your hearing, wear hearing protection. That's really important, and making sure that they know that as they start treatment. And then also using a soft toothbrush, not using floss, and avoiding sharp razors because there's an increased risk of bleeding. And then also letting them know if there's any questions or concerns, because this is just kind of a quick infographic set of information just to let them know where they can contact me if they have questions or concerns, and then also my references. And as you could see, just to kind of make things a little bit cleaner, I used numbers and was able to kind of put in text citations with numbers with my references to just kind of keep things concise. I actually had someone read over this just as a quick check to make sure that the language didn't seem too overwhelming, because I know that's really important as most people read at an 8th grade level or below in the US. So making sure that all this language was easy to kind of digest, and that the flow seemed okay. So that's my quick infographic, but thank you for watching.